Sexual abuse, usually sexual abuse, the victim is a female and the perpetrator is almost always a male. Again, it's usually someone that the victim knows. It's not somebody out there in the middle of nowhere jumping out of the bushes. It's someone that they know. A brother, stepbrother, uncle, mom's boyfriend, somebody that they know is usually the perpetrator. Many times it's just finally reported by the victim. They just can't take it anymore. Always suspect child abuse or sexual abuse in any pre-pubertal child that has a sexually transmitted disease. They may present with some symptoms like a urinary tract infection or some discharge and bruising. They may also present with some acting out behavior. So those are all make you suspicious. Again, a good history and physical. You have to document everything. A negative exam does not rule out sexual abuse. That doesn't mean that the child wasn't abused if you didn't see anything on physical findings, because there's a wide range of what constitutes sexual abuse. Remember the hymen on physical exam. In a child less than 5 years of age, the opening of the hymen is less than 5 millimeters. And then it grows, the opening grows by 1 millimeter per year up to 9 years of age. You should always look for any sexually transmitted diseases and treat them accordingly. You can also gather samples, and don't forget to follow the chain of command. Everything has to be documented, written down, or else you lose valuable evidence. And again, you need to notify the Child Protective Services and the proper authorities. Certainly, the victims need psychiatric counseling, as well as many times the perpetrators need psychiatric counseling. And the patient, depending on the conditions, may need to have placement in a foster care environment. Here are some patients that have had, unfortunately, sexual abuse. Here we see abrasions, for example, right down here, some abrasions. Here, more abrasions and actually some trauma. And this is a major laceration here in this area from sexual abuse. Once again, any patient that has a sexually transmitted disease that is prepubertal, you should consider that patient to have been sexually abused. These are condyloma acuminata in a baby, so this is a sexually transmitted disease. If this is a child that's prepubertal, that's sexual abuse.